Interesting. So, the lesson learned today is make sure you look at your ingredients in your testosterone, because if there's cottonseed oil, you're going to get fucked up.
Yeah.
And you're welcome.
And I think, in summary, testosterone is safe and effective for most people that have low testosterone. So the best thing to do to start is take the Adam questionnaire. If you answer yes to number 1 or 7 or 3 of those questions, then it might be worth talking to your practitioner, getting a blood test, and then if you decide to do testosterone, don't worry about the 2 side effects that most doctors are worried about. And if your doctor's worried about that, educate your doctor. Look it up. Show me the data. Where is it specifically showing that testosterone therapy can cause prostate cancer or make it worse if I even had it in the first place? And does it actually worsen cardiovascular outcomes? And it doesn't. And then if you decide that the risks outweigh the benefits, because there are other side effects that we didn't cover, they're not nearly as common or nearly as worrisome for most doctors. And there's other ancillary medications that can offset those side effects, like estrogen blockers and so forth, DHT blockers as well. But if you decide to do the testosterone, I would highly recommend testosterone injections. There are lots of them available.
Do you know any specific names of ones that you would recommend specifically that don't have cottonseed oil in them? Because I'm sure a lot of our audience would really like to know that.
If you decide to proceed with testosterone therapy, request from your physician that you get testosterone cypionate, which is the most common form, in grapeseed oil or sesame seed oil, because they've been used for decades, and we know that those are safe and effective for most people that have low testosterone, that they're trying to improve that. It's on average a once-a-week injection. Your doctor can do a blood test to figure out what dosage you need, or estimate it and then do a follow-up blood test to make sure that the levels are actually where you want them to be in the reference range. And from there, don't worry about all these crazy accusations and side effects. So there's one caveat to this whole episode.
And what is that?
What happens if you have an elevated PSA level?
And that'll be for our next show. Jesse, thank you for coming on. I really greatly appreciate you finally doing what I wanted to talk about for like 20 freaking years.